Now I'm going to show you how to set up a augmented TSA for Dr. Bailey. Typically, he would have a patient-specific PSI guide that you'd shoot your pin and your derotational hole through, but we don't have that. So for instance, I'm going to show you how to set it up if you don't have one. We're going to set it for a small 15. So you'll come in, you'll grab your chip, you'll grab your trial, you will grab this silver piece right here. This will screw into the flat face of the chip. We're going to grab the peripheral drill. We'll grab 2 to 3 pegs. We're going to grab, this is the drill sleeve. It's marked small, medium, left. We're going to grab the center quarter lock drill. And then we're going to go to the bottom. Out of the bottom, we are going to grab this guy right here. We're going to grab, this is your derotational drill. And then here is the neoreamer. So we'll put this together. Neoreamer, you're going to take white block in your left hand. You'll see there's a foot in there. There's a trigger right here. What you'll do is you'll put this into the foot. You'll pull the trigger down so it slides into these crevices. It'll click in. Now, we're going to take this guy right here. See this foot and these feet? It's going to perfectly fit right over just like that. We'll pull this down and you can set it to 15 so it stays on there. We're going to take our center rod. This will throw right down the middle. You want to make sure it's flush. If it's sticking out, it'll cause issues. Now we want to take this guy, put it on the bottom. Make sure you can hold your thumb down so it doesn't pop up. You want to make sure this is threaded properly, or else it'll get caught up. It'll get jammed. Take our reamer head. We're going to do the small. So when you're putting the reamer head on, it'll just continue to spin. You want to pull it down and put it behind 15 so it's in the lock position. You'll see right behind it says lock, and you'll twist on your head. If you need to, this guy goes on here, can help you spin it on. Usually you can do it by hand. We're going to put it to 15. Then we're going to take this guy right here. This is for your derotational hole. You're going to pull this down. See this? It's going to slide onto here. And this peg right here will be the thing that's holding it in place. Now we have our neoreamer put together and ready to go. Now I will show you how to put it in order. So first, we're going to take this guide. He can hold it, put it in there. We are going to put the derotational drill bit. So we're going to have a peel pack pin that'll be with the instrument setup. Take this peel pack pin. Then, as you can see in the chip, there is a hole for the derotational hole. There's a positive stop, so it won't go too far. So you will do that. Drill that. This will be out of the way. You're going to take this purple reamer. You're going to go into the half moon tray. All of our augmented implants have a backside radius of curvature of 40. So you'll go grab the 40. This is small 40. It'll pop on. We will take our neoreamer. After the neoreamer, we'll go back. You can use your checker. You'll put your checker there. This is the peripheral drill bit sleeve. This will slide. And with this, the chip, you'll see that the augment is to the right. So you will put it opposite of the shoulder that you're doing. You're doing a left shoulder, it'll be on the right side. You'll slide this guy right over the top. As you can see, there's an anti-rotational hole. It'll fit just like that. You'll put that in. You'll take one of the pegs. you will drill through. It has kind of a sleeve right there. Peg will stay in. Pegs in. Load another one up. Drill. You really only need 2 drills, or you need 3, but then this quarter lock hole, go like this. You'll take this whole thing out. You will drill your central hole, and you'll come and for the trial, you're gonna take these clamps right here. Like I said earlier, you're doing a small left. You want the long side to be opposite of the side shoulder you're doing. Left shoulder, long side goes on the right. Clamps in, boom. We have the impactor, and then we have this clamp right here for the final implant.